This segment is sponsored by Smile Dental Partners. Have you been to the dentist since the pandemic set in? I know a lot of people are still concerned about the safety of going to see the dentist. Dr. Darren Riopelle owns and operates Smile Dental Partners, and he joins us now to talk about the extreme measures his team has taken to keep you safe in the chair. And it is good to see you again, Dr. Riopelle.
Thank you. Thank you for welcoming me back.
Oh,
Um,
you bet. The dentists in West Michigan, they've reopened, many of them employing safety measures that are recommended, but you've gone a step beyond. You've introduced something called UVC pathogen control technology. What is that and how does it work?
yeah, so it's a couple different avenues. So the UVC is out in other offices or other areas now, but we actually installed ours into every single operatory, every single place where someone would be walking around. So it continuously is recirculating the air. And as it recirculates the air, it sends it through the UVC light, which actually kills everything in that air. So it makes the whole environment a lot better. It's to a point where you walk in the building now, like, yeah, it doesn't even smell like a dental office anymore. So the other advantages of that, and it runs 24/7. So it's not like when the furnace is on or not, and it's right to that point of the room. So each room has one. And they're in the ceiling, so they're not obtrusive, and they don't look scary. So it's good. And then we added one extra thing with not just the air is that, the big issues is touch points, is everything's on your hands and touching it. So, we have to wipe a ton of stuff down all the time, but one of the biggest sources of touch points in an office is the keyboard in an operatory or at a front office or anything like that. So we actually have UVC lights, motion sensor that sit over the keyboards that constantly is eradicating any sort of pathogens in that as well.
So every single touch point in that office, but in particular, those areas that get a lot of use. Okay, so as I mentioned, a lot of people still concerned about going to see the dentist. And so they're weighing the pros and cons of delaying the care of their smiles. How do you come into that argument? What's your recommendation?
So, well, we already know what happened when people couldn't go to the dentist. There was a lot of emergencies. There was a lot of treatment that we saw 6 months ago that was in the schedule. And by the time we got back to it, it was worse. People went from something small to something larger, or even ended up losing some teeth. So I think it's more important to go in, get it assessed, make sure you feel comfortable. If you have questions, call ahead. At this point, most offices have done a great job of preparing their patients. Yes, we're over the top, but every other dentist is doing a really good job out there. And on top of that, if you take a look at statistics, there's been millions and millions and millions of dental appointments seen during the pandemic. Not one has ever had a transmission direct from an office, from a hygienist to a doctor, an assistant to a patient. So honestly, I think dentistry as a field has learned a lot through this process, but it's the safest place to go. And by not going, you're actually going to probably cause yourself more harm than not.
Yeah, okay. Understand you're even doing some remodeling there at the office. What are you doing?
So one of our newer offices in Holland, we were taking a look at all the things that our other offices are certain. It's newer to us. So we took a look at the traffic flow. We took a look at the context of the building, the materials, and we discovered that there's lots of improvement we could do. So we actually took some rooms that were a little more open, too much open for us, closed them off, put UVC angels just in those rooms, and replaced with the flooring. For some reason, this office was only, it was relatively new, but it had carpet everywhere. And carpet isn't something you can wash off, especially in an operatory. So we're removing all the carpet and changing the countertops and minimizing the things that are in the facility. At the same time, we're also adding our Little Smiles pediatric wing. So it was convenient to do both at the same time.
Very nice. Speaking of the children, a lot of kids, they're back in school and their regular dental visits are coming up. Should parents still stay on track with all of that?
Absolutely. Yeah. We've had so many parents ask that question, but once they come in, they're like, this is the safest place out there. So yeah, especially for the kid. I mean, at least, kids have nothing routine right now. At least keep something routine for them. Maybe if it's a dental appointment, keep it routine.
Yeah. Right.
With kids' teeth, they go so fast, you have a child's tooth, but that child's tooth sits next to an adult tooth. They're going to keep forever. So it's important to get them when they're small.
All right, keep them coming in. Smile Dental Partners, 4 locations here in West Michigan. We've got Cascade, Grand Haven, North Muskegon, and Holland. We have put contact information and a link to their website at 13onyourside.com. Dr. Riopelle, thanks so much.
Thank you, Catherine. Have a great day.
You too.